My name is Amanda Taylor. I'm an infection control nurse here at Clarendon. I have been in this position for about 2 years, but I've been with Clarendon for a total of 8. I love Clarendon. I just want us to be ready and prepared. So the point of our forum today is just to kind of see, let you know as a community where we are, what we're doing to prepare, and what you can expect when you come to Clarendon. Just as far as our screening process goes. So I'm going to go through just a little bit about what Ebola is, how it's transmitted or spread. Some of the words in here may be a medical term that you may not understand. I'll do my best to kind of go over those. This presentation is what we have been showing all of our clinical staff here in the hospital. At the end, I'll kind of breeze through that a little bit. That just kind of shows some of our algorithms or instructions on how we screen patients and the process of how we isolate and actually notify DHEC and go through that process as well. But if you have any questions, we'll take those at the end. And then we're actually going to have a demonstration just to kind of show you the level of preparedness that we are in should we actually have to quarantine a patient here in our facility. So let's go ahead and get started. So Ebola is also known as EBD, which is Ebola virus disease. Again, we're going to talk about what it is, where it comes from, how is it transmitted to humans from animals, what our current situation is, are we having any outbreaks and where we've been, how Ebola is spread or transmitted, how it's treated, and how can you protect yourself. And of course, what would you expect when you come to Clarendon Health Systems, whether you come in through our ED, here as an outpatient, or in one of our clinics. So just to kind of give you a heads up. So it's known as a hemorrhagic fever. So anytime you see the word hemorrhagic, that just means bleeding, or bruising. So that may kind of help you there. It's a rare, deadly disease. It actually comes from 5 different types of strains. The one that's caused the most concern is our Zaire. That's the one that's currently responsible for the outbreaks in Africa. Normally with any type of outbreak, they usually start in a small village or a small community or a rural area and spread out. What makes it different is it actually started in 3 different areas in West Africa at one time. So we have 3 different areas that it spread out in. Normally what happens, a virus or a disease will start in that area, it'll die down, and then you kind of really never hear about it again until it sporadically outbreaks again. So that's kind of what's going on in Africa. It's not a new virus or a disease. It's actually been out since 1976. It originated around the Ebola River, which is now known as the Democratic Republic of Congo. And again, just sporadic outbreaks that seem to die down. They really don't know why it dies down, it just does. So they really haven't done a lot of testing with it from my understanding. They don't really know the actual reservoir or host that it comes from. They've narrowed it down to, they think, bats. They think bats kind of host this virus, and then it kind of spreads through other animals. The bats will, of course, infect apes or monkeys or deer, and then the people of Africa they think this is a delicacy, and they will actually eat it and they call this bush meat. So that's how it's transmitted from an animal to a human species. This will just give you a little idea of where in West Africa this is taking place. The little square at the bottom will kind of pinpoint West Africa. Now, of course, these slides are changing every day, and it's just showing you where the outbreaks are occurring. Now, the one over to the left is actually showing you a map of the United States. The yellow areas with the dots are actually areas where the CDC has set up quarantine stations. Most of those are along the East Coast because that's going to be where these people are coming in. And of course, it's going to be right around those international airports. This is just, should an outbreak occur, the CDC would have a place to actually quarantine people. Just to give you a little history on where we are, and I didn't use names, but the names, of course, have been all over the news. You probably are familiar with some of them. The first 2 was actually the cases brought back from West Africa. There was a doctor and a nurse that were taken to Emory, Georgia. Both of them have recovered and are doing fine. Then there was a doctor and a cameraman that were brought back from West Africa, taken to Nebraska Medical Center. Both of them have recovered and are doing fine. Then we had number 5, our man that traveled from West Africa to Texas, presented at an ER. He was not feeling good. He had a fever with an additional symptom of abdominal pain, and I think another additional symptom. He actually was not diagnosed with Ebola at that time. They actually sent him home. He progressively got worse over the next 2 days. He went back to the emergency room, and that's when they realized that he possibly was an Ebola risk. So they, of course, quarantined him, ran the test, and he was positive. They actually had, I think, a total of 48 healthcare workers that have went through contact with him or took care of him, and out of 48, 2 of them actually were infected. They think this was possibly because of the severe blood and body fluid that they were exposed to, because as we'll learn here in a minute, this disease will progress very quickly. In the early stages, you'll have just those minor symptoms, but as it progresses, you're going to have a lot of body fluids that you cannot contain. Of course, they were dressed in full PPE, but that removal process of the PPE, or the personal protective equipment, is just as important as putting the material on. So we've gone through extensive training with our staff over the past 3 weeks, making sure they understand that hazmat equipment, making sure they understand that process of removal, because it takes two people to do that. We call that the buddy system, and you're going to actually see that here in just a minute.